November is National COPD Awareness Month. We asked our VIeMed respiratory therapists across the nation what are the most common misconceptions that they see and hear out there in the field about COPD. Let's get into it. Okay, number one, COPD only results from smoking. While smoking is the leading indicator of COPD in the developed countries, there are many risk factors that can go into COPD. Genetic susceptibility to the disease, secondhand smoke, air pollution, workplace exposure to things like dust or smoke or chemical fumes are just a few of the ways that somebody can get COPD other than smoking. The best way to prevent COPD, however, is to never start smoking in the first place. But if you are a smoker, smoking cessation as soon as possible is the best way to manage the disease. Number two, COPD only affects the lungs. So while COPD is a lung disease, other organs can be affected, especially in later stages of the disease. The heart has to work very hard to pump oxygenated blood through the lungs to get it to the rest of the body. So what happens is over time, the heart muscle begins to weaken. So it's very important for anybody with COPD to keep all of their doctor's appointments with all of their specialists and be sure to follow all of their medication regime and any rehab that's prescribed to them. Okay, number three, people with COPD should not exercise or do any physical activity. Now, while strenuous physical activity is not always possible for people with COPD, the right amount of exercise has many benefits. Your doctor and other members of your health team can help to provide the right types of exercises that are specific to your disease that can help you to live a more full and active lifestyle. Number four, COPD only affects the elderly. The truth here is that anybody can develop COPD. However, the highest risk population for developing the disease is anybody over the age of 40 who was a former smoker. And finally, number five biggest misconception about people with COPD. People with COPD are not able to live a normal life. COPD is a disease that can be managed with the help of healthcare providers, proper diet, exercise, medications, and assistive respiratory medical equipment. By taking charge of your health and utilizing resources that are available to you, you can go on living your life. According to the American Lung Association, an estimated 15.3 million Americans suffer from COPD, and several additional millions likely have COPD and don't even know it. Early diagnosis and treatment can help people with COPD to improve their quality of life and health. VIeMed has put out some really impressive and compelling research referencing these ideas. So if you're interested, check out viemed.com/studies. And remember, live your life.